Today we're being joined by Briaa Baldwin, who's one of our patient family partners on the Power of MoMMAs Voices podcast. And thank you, Briaa, for taking time out of your super busy schedule to meet and chat with us. I really appreciate you being here.
Of course, Nicole, I love being able to meet with you and other people's of Mama's Voices. So I'm excited to be here today.
Awesome. Thanks. So as I've been starting these podcasts, as we've been talking to different folks, we really wanted to have this opportunity in this season to have patients, people with a lived experience, get that chance to share their story, to get out that message to other clinical teams and other providers so that they can really hear the heart of what we're working on and have this opportunity. So for you, if someone only listens to the first 5 minutes of this and they don't listen to the whole thing, what is something that you want them to take away from today?
That's a great question. I think the first thing that I thought about immediately is that every birth story deserves to be told and heard. That is the first thing. I had three live births. I have three beautiful girls, and for a long time, I thought my story didn't matter because essentially it didn't end with a loss, but it did end with a loss in a lot of different areas. Not the loss of my children, thankfully, but in other areas. And I think the second biggest thing is, as a patient and as a provider, ask questions. And for the provider to listen to those questions and actually respond. I found it almost felt annoying for me to ask so many questions, but I realized that is the way that I learned how to advocate for myself because I just didn't know with my first, second, and
Mm,
third pregnancy. They were all very, very different. And so for any patient hearing this, I want you to know that your story matters and that it's important for you to ask questions of your care team and for you to get a response that you think is adequate. That was my
mm.
TED talk right there. My
Get your TED talk. I love that because I mean, even recently, there was last week or the week before, I was talking to someone and they're like, I just don't feel like I have like a story. And it's one of the things that we've always really, I guess, prided ourselves on is that
yeah,
everybody does have a story. And because we do so much work with the healthcare providers and the clinical teams and the quality improvement teams, we know what they're looking for. And we're able to help work with people to pull out what those key points are that are going to make an impact and make a difference. And so, even people that are like yourself that are like, we went home,
yeah.
and
Hmm.
sometimes that's the bar. Like, did everybody go home? Um,
Right. And it's such a
there's
low
so many
bar,
different
right?
things.
Yes.
Yeah, the bar's not that high.
Yes.
But there are so many other things that can happen to a pregnancy that need to be heard. And so I thank you for bringing that up and making people that feel like we crossed that bar and so I don't have a place here feel like they are welcome and do have an opportunity and their voices are needed.
Exactly.
So we'll talk about your pregnancy journey. Well, we can talk about your pregnancy journey or your advocacy journey. Which one? I don't know which one you want to start with, but what is it that really got you into this space and being like, this is a calling for me and something that you have now really grown with your work?
Yeah. I've been very fortunate. So I was introduced to Mama's Voices actually through my current position. So I started this role 2 years ago as a project manager. They wanted to basically improve relationships between outpatient clinics and community based organizations, as well as launch the first ever statewide patient and community action board. And I thought it was super cool for me to be able to use my birthing experiences as a Black woman to be able to share that and engage with other people and really create a safe space for us to have these discussions, right? And before I got started, you guys were already connected with my supervisor. And so I think I had a more of a non traditional role, but I will say, once I was able to take the training with you guys, I feel like that's when my advocacy journey really started, right? Because before I'm thinking I have three healthy kids, well, healthy-ish kids. They're home. I'm here and alive. My story doesn't matter. And I went through that course and I was like, holy cow, like there's so many scars that we have from having children that are just not seen. And I feel like the
Mhm.
first time I felt seen and heard and understood was when I took my training with you guys. And so that's when my advocacy journey truly started. Yes. And so, yeah, and I'm
Great to
thankful
hear.
for that. Yeah. With all of my pregnancies, they were considered high risk. I had hypertension, gestational diabetes. And with my last one, I almost bled out. But again, I got to go home. So I was like, oh, we're good. And I remember talking to you, Nicole, when I did my training and telling you that story. You guys were like, wait a minute, that's actually pretty severe. And so I realized then that a lot of women have those hidden scars and how important it is for us to make space and give language to what that feels like and look like and support. And so that's kind of how I got started on my advocacy journey.
I think that, there's something that to be said about being able to share your experience and understanding where their scars. I was talking to somebody just yesterday who's been a public speaker for 40 years. And she's like, I applaud you guys because there's no way I could talk about my health pregnancies 23 and 28 years later, even still. And this is what I do for a living, is talk.
Mm-hmm.
And so I really am proud of the advocate readiness section of our training because it's necessary, it's needed. And it really also is that place to like, oh, this is heavy work and it's going to continue to be heavy work. And so making sure that folks are prepared for that. It's just one of the pieces I'm like, yes, we have that. We did that.
You guys have that down pat. Yeah. And I'll say I'm always so supportive of you guys and just really in awe. I mentioned we've been able to launch a patient and community action board, and each of our PCAB members go through the Mama's Voices training. And for a lot of people, their kids some of them are like high schoolers or grown, and they're like, I've never actually told my birth story. I've never sat with it. I've never shared it. And what I love again about the training, it teaches people how to be an advocate for their story in a lot of different areas. It helps us to write the story, to, practice it, to have somebody kind of walk through it with us. And to be able to give that to our PCAB members has been, I think, one of the biggest, I guess, but advocacy fulfillments, because I felt the same way. And they're like, I didn't realize how much I needed this until I went through this course. And so I love that for any birthing people to go. And I'll plug this all the time, but the training really is for, I feel like, every person who has went through a birthing experience.
Well, thank you. Thank you. That makes me proud to hear that from, your position and what you're doing and what you're seeing and working with folks as we continue to, I don't know, share the good news, I guess, is one way to put it. So now with your pregnancy experiences, you had 3 different pregnancies, different kind of things happened. What were some, if you're okay with sharing some of what those, now you recognize those scars, where are those things that could have been done differently to make your experience, to improve your experience?
Yeah, I think that's a great question. When I think back on all of my pregnancies, one of the things that I wish I would have known more was just really, I think, being better educated on what the birthing experience was going to look like, right? So, like, we have a birthing plan, but what happens when things don't go to plan? Like, how is that going to be communicated to me? I feel like because I was high risk in all of them, decisions were made very, very quickly without me being able to think, is that what I really want? Do I want to get induced for a third time, knowing my last 2 inductions were horrible experiences? I also wish I knew more, especially in my first birthing experience, about doula support. I think I would have benefited tremendously because I was in active labor for 2 days. My child was in vitro. We knew that she only had 1 functioning kidney. We knew that the anatomy around her heart was abnormal. They thought she had Down syndrome, but we ended up finding out about a week later she was diagnosed with something called DeGeorge syndrome, or 22q. So right now, my baby is 10, but she sees about 19 different specialists, inpatient and outpatient. So it's a lot. And so they were telling me this while I'm in labor, like, she may have this, this genetic disorder. I'm Googling it and I'm literally spiraling, because if you read about DeGeorge, it's like worst come scenarios.
While you're in labor? While
I'm in labor. And it was really mentioned, it was so weird because I'm literally actively contracting, and this has to be day 2, actively contracting. And a nurse mentioned it, like, oh, I see the doctor thinks she has DeGeorge. And I was like, no, they've never mentioned that to us. But my mom and I are literally both Googling this. And so now I'm like even more like uncomfortable and just freaking out. And so I truly wish I had a doula to be an advocate for me. And I'll say even in later pregnancies, I'd never end up having a doula. But I also wish I had that person to support me amongst my family and friends. You know, you're in active labor and there's a lot of different people, a lot of different opinions, and I love them, but it was very overwhelming. And so, outside of like the education, what my birthing experience was going to look like and how we were going to communicate any differences of them, but having a support person just for Briaa, I think would have been really, really beneficial for me. And I think for anybody in that space, right?
Yeah. So, one of the things we talk about, I wouldn't consider this necessarily like informed consent, but like educating patients properly and not talking like over them. So, maybe it's not informed consent. Like I'll say trauma informed.
Yes,
Sorry.
yes.
More trauma informed of having these conversations before a nurse just blurts it out.
Hmm.
Oh, I see this is in your chart. And then you're in the middle of like these conversations should have happened. I'm assuming you had some like genetic testing that
Yep.
happened that rolled out the downs to get you to that point. Like they would have known about it much earlier
Hmm.
than you're in the process so that you could have wrapped your head around it and mentally prepared yourself before then. Oh my goodness.
Yeah.
Wow.
And I think it goes back to some of the work we're trying to do now is really closing the communication gap between different providers because I started out in one office, but because I was high risk, I had to go to a different office in a different hospital to be able to support me and my child, which I am super grateful for. But there was just so many gaps in communication. And as a, first time mom, I didn't realize that. I'm just thinking my doctor told me this is going to happen. This is what I need to prepare for. This is the plan. And I'm just listening to them. And so I think as a patient too, just making sure we're being advocates for ourselves, right? Like this is
Yeah.
what we talk about, like making sure we're comfortable asking those questions. And if we feel like we're not getting those support people in house in seat that we feel comfortable with, right? And that may mean we need to shop around a little bit, but I think it's so important.
Mm-hmm.
Looking back on my 3 pregnancies, I wish I would have had that person that's like, no worry, Briaa, I got it. Right? Because as a mother, we're thinking about
Yeah.
our baby and everybody else, but we're not thinking about
Mm-hmm.
ourselves a lot of times.
Mm-hmm. So knowing like being deep in this space
Yeah.
now, okay, like before I was in this space, when I had my daughter 10 years ago, I was like, I do not need a doula. I'm not crunchy granola. Like I equated doula to like home birth. It was really what was in my mind. And I'm like, no, no, no. I need an OR. I need surgeons. I need blood bank. I need things.
Yeah.
Had no idea. So like now that I'm in this space and I understand it, do you think that like knowledge is becoming like that awareness of what a doula's role can be is becoming more known in like the general public and general population besides those of us that are knee deep in this space?
Yeah. I think so. I do think the gap that I've seen is that I feel like the doula is a support person, not necessarily a part of I don't want to say they're not a part of the care team, but I feel like my provider and doula should be theoretically working together. And so
Mhm.
I feel like, yes, I feel like more people are starting to know about doulas, but I don't think they realize there's maybe sometimes like what they fully encompass, which is really to be the advocate for the mother. They're not there
Mhm.
to like remove the baby. They're not there to do a lot of those like I guess provider tasks, but really to work in tandem as like a bridge between the provider and the patient. And
Mhm.
so I do think so, but I don't have any like data to support that. But from like the people that I speak to in the
Yeah.
community, and I do hear like we want doulas, we love doulas. How do we integrate them better
Good.
to make sure they're able to support the patient fully?
Mhm. Well, that's great to hear because I know it's been 10 years, but still I'm like, man, I was under a little rock. And so I hope, learning now, it's like I could have used that as well
Mhm.
because of going from you having like the first pregnancy and delivery of being and being very overwhelming. The next one, it's like is the how do you respond and how you reacting and how like all the what's going on in your head for the next delivery. I get to use somebody that had been there, like holding my hand and be like, it's going to be okay. Like, this is what to expect, because there's still, I don't know with you, with me, I had like, first was emergency C-section. The second was scheduled. And there's a big difference. And I don't remember what happened in the first one. So yes, this is my second pregnancy, but talk to me like I'm the first time,
Mother,
mom that doesn't know any better, because I don't know what to expect. So that would have been really helpful to ease my mind, I think, and just to be supportive in that way and explaining like the jargon. Still, I love my care team, but there's still stuff that like, is just assume that,
hmm I agree. I agree. My older two are about 18 months apart. And so I feel like I didn't get a chance to really catch my breath between pregnancies. But I agree. I still feel
Mm,
like there was things that I went into my second one, for one, having gestational diabetes. I just didn't know. And for any of my mamas that have gestational diabetes, oh my goodness, it is a mental and emotionally taxing thing. Like, I think anything in pregnancy is just exacerbated, but I wasn't thankfully on medication, but I had to check my sugars twice a day. And just mentally, I just physically did not want to do it. By like month 8, I was 8 months, so Haley was 1.5. I just did not have the space to like almost take care of myself. And so there's a lot of things
mm,
still, like I said, even them being so close, that I was just like, I just didn't understand like how important certain things were. And so that led
mhm,
to me having to get induced a second time, because I theoretically wasn't taking care of myself. And again, having that doula or support person that kind of understands,
mhm.
Briaa, you need to go and do A, B, and C. I think that would have been super helpful for me to have that person, that support person.
And so that's a good like point too to kind of poke into. It's, and people get labeled as like non-compliant, right? And
Oh
so,
my, I hate
oh
that
my
word so much.
gosh, right? So like, are you being a compliant patient or not? And so digging in and finding out like why it's not because I want to be like, I want to non-comply. Like, there are some people that are stubborn and just don't want to, but sometimes that's not it. Like, is it you're stubborn, or is it like there's a lot going on at home? You have an 18-month-old baby that's also has complications, and you have maybe not even processed that experience, and here you go again. And so just like understanding, so much of this is like, what's going on in her head?
Mhm. You know what? That word non-compliant is funny, because the rooms that I'm in now, like I mentioned in the beginning, we try to support outpatient clinics to implement non-medical screening for all patients, and providing them with some resources and some care adjustment to make access, to remove barriers
Mhm,
to access and care, right? And I remember being in a meeting, and the word non-compliant came up, and I was like, I hate that word. And I was like, and I
mhm,
say that as somebody who was non-compliant, and I say that as somebody who has a college education. So, I think sometimes we link non-compliance to maybe lower socioeconomic status or certain, identifiers. No. Sometimes as mamas, we just don't have the capacity to do A, B, and C. It is
mhm,
so funny, because when I had my second daughter, I kind of knew that if they were calling me in, they were going to induce me. And so I went and got my nails done. I went and cleaned up. I went and ate, because they tricked me the first time. I didn't know when I got induced I couldn't eat. And so I was like, oh, you're not getting me. So when I finally got to the office, they're like, we've been waiting on you for hours. I was like, I know you were. And I know I'm not compliant. And she asked me, like, have you checked your sugars? I said, I haven't checked them in about a week. And it's not because I didn't care about myself or my baby or my body, but mentally I was exhausted. And had somebody just asked
mhm,
me, like, hey, what can we do to support you? I would have told them, like, or, at the same time, my oldest has, I mean, then it was way worse, because we were seeing doctors like every 6 months. Now they're spaced out. But I was trying to save my PTO for maternity leave, but I'm also having to make sure that she's getting the care she needs. And between
mhm,
August of 2016 and December, we were in the ER urgent care clinic room every single month while I was pregnant. So if
mm.
it's between me making sure my child is getting what she needs and I'm poking myself, I was always choosing my kid. But if they would have asked me, I would have told them. But so I was non-compliant all throughout my pregnancy. And I just hate that word so much.
Mm.
Ugh,
I do too.
hate it.
I do too. I'm like, I'm not being stubborn or hot-headed or lazy. Like, let's dig in. Let's dig a little deeper. And how can patients be supported? How can families be supported that way? That care teams ask those questions and
Mhm,
don't just judge a book by its cover or make assumptions on what they
mhm,
think it
mhm,
is. And really that's a way to support people is
mhm.
what's going on? What's going
Yeah.
on? What's going on at home?
Mhm. And I remember telling my doctor, I was like, it's interesting because I took a course on how to support diabetic patients before I had kids. And I remember thinking, like, why wouldn't people just do it, right? Like they
Mm,
need to do it. And I was like, here I am. And I'm like, I don't want to. And I'm like, it's not, it's I'm telling you, just the physically having to get all of the stuff, it was so draining. I was like, so I see why people don't do it. Not that I condone it, but again, like you said, how do we support people in that space? And so I had an amazing supervisor at the time who was a nurse for her kids' school like years ago. And in the morning at work, she would actually help me take my sugar levels. So I thank her to this day because she supported me through my pregnancy. She was so kind, and I was exhausted, and I just had such a great village outside of my clinical team, but it was still hard because I didn't even know what kind of questions like support to ask for at that moment. So I agree, Nicole. It would be nice if we said like, how can we support our patients that we say are non-compliant, and how can we help them get to where we know they can have the best pregnancy outcomes possible?
it's like meeting them where they're at and meeting
Yeah.
people where they're at. Like, what can you do? Okay, if you can't do twice
Mhm.
daily finger pokes, like what can you do? How can we help to make improvements? Like, well, hey, we're in this quality improvement space, like
Yes.
making some things better than nothing, like, or what can be done. And so oh man, I love to hear that your coworker was able to help you with that because that
Yeah.
makes a difference too. Having a little accountability partner also of like, I know
Mhm.
it's hard, but being able to sit down and get that done, that's great to hear. What
Yeah.
other things would have been supportive to you through any of your pregnancies?
Something I thought about after connecting with Mama's Voices is how I could have, or not me, but the like my providers could have supported my husband in this space. When I think about my pregnancy journeys, like he was always there, but he was almost kind of like off to the side versus like we're having this child together and actually
Mhm.
engaging both of us. And I think about it more so with my third child because that was actually during COVID. Well, 2021 is when I had my last one, and there were just things that was happening that he just wasn't aware of. So like as and it's I laugh because it's incredible to think about now. But after I had my youngest, I started bleeding profusely, like profusely. They didn't know why. I did have some fibroids, which I had asked them about. I remember asking them about it. Like I tried to be more diligent in my third pregnancy because I'm like, I've been through this 2 times. I'm like trying to stay on top of things, but still, I still have 2 young ones at home, 4 and 5. I'm working full time, but I'm still trying to stay on top of like my health. And so, had fibroids, and I think that's what ended up causing a lot of the bleeding, where they thought they was gonna have to do a blood transfusion, and I was just petrified. And my husband was asleep, and I was like, no, don't wake him. But no, as a provider, it should have been, let me actually get your support person here to figure out what's going on so I can communicate to him what's going on. Because God forbid something was to happen to me and I didn't wake up or make it out of that alive, he would have had no idea. And how terrible for him,
Mm,
right? And just thinking
mhm,
about him having to then, because when he finally woke up, I mean, it's like blood everywhere, nurses running back and forth, like it was scary. So he's waking up like, what is happening? And I don't remember if anybody ever specifically addressed him. And so I think in these
mhm,
spaces, it's important for, I mean, I don't think it should be on the birthing person, right? But still, to bring in our support people, whether it's father, mother, auntie, uncle, grandparents, like bring them in this space because we need a village. Like with any kids, any birth, we need a village. So I think that's
mhm.
another thing I wish I would have been more intentional about, like bringing my husband in making them know he's a part of these decisions just as much as I am. You know what I mean? So that's something else that
Mm-hmm.
I thought about for my third one. Like that's really critical, and I don't think we do that a lot in our medical system.
Mm-mm. No, I mean it's you think back too to like after delivery, the mental exhaustion, the physical exhaustion, the all the things like if depending on how sick somebody is, like they're those I say this all the time, like you can look at them and see they're not all there. Things are not clicking, and so they're not sinking in. And so as a mom, as someone that just had a baby, you need to have the people around you that are also aware because hopefully their brains and their two brain cells are working better than your brain cells are working. And maybe, putting it together, we'll figure it out. But like it does take multiple people hearing what's going on to understand the situation and to be able to have like that good follow up afterwards. How are you going to get taken care of? And so just the whole thing is like, it's important to remember who's in the room. And your poor husband, oh my gosh, like he was out. I can see this because I'm like, no, don't wake him. No, no,
Oh
no.
no, because
Let
I'm
him
like he's
sleep.
exhausted, we're exhausted, and I'm like, wait, no, he should have been aware. Um, and it also makes me think it's just women. We have got to take care of ourselves better. I feel like we, especially as I mean, I think most women, but especially as mothers, we prioritize everybody else. Because you just said something that made me think about my youngest first doctor's appointment. So I went in for just a regular checkup on a Tuesday, and my blood pressure was blood pressure again. So I not only for my last one I was healthy, like walking every day. I barely gained weight. I was watching what I was eating. 39 weeks and 37 and 39 weeks, my blood pressure was high. And by me having a history, they're like, we're worried. And so me and my me and wife were actually crying in the appointment together because she's like, I gotta send you in, Briaa. And I was like, no, I don't want to go. She was like, we talked about this. And one of the things that I talked about with my third child was in every doctor's appointment, I said, I know I'm high risk, right? I'm 31, having my third child. I've had two high risk pregnancies. I'm Black. I need to make it out of here alive. And I had just read the article about Black women dying, being 2 to 3 times more likely to die. Let me take that. Let me rephrase that a little bit. I read an article that said white women were 2 to 3 times more likely to live after a birth than Black women, and it
Mm,
petrified me. And so I went into every doctor's appointment because they have you see different providers, right? So just so in case your doctor's in there, they know you. And I went into every doctor's appointment saying, how do I advocate for myself, right? I got two small kids at home. I got to make it out of here alive. What do I need to do? And I didn't realize that was a trauma response until recently. And so we get through the pregnancy journey, have my baby, almost bleed out. I'm in the hospital for about a week. That I get out on Sunday, Mother's Day. I took my daughter to her first doctor's appointment by myself Monday morning. And I get there, and the doctor is like, "Where is your husband?" And I was like, "Well, he had to drop our other two babies off because as mothers, what we're so worried about everybody else but ourselves."
mm-hmm.
And they're like, "You're not supposed to be driving. You're not really supposed to be carrying anything. You literally almost like died, and you're here driving like it's nothing." And it didn't even cross my mind because I feel like as women, we're learned to what? Pick up and keep moving. We got to
Yep.
take care of ourselves. We got to. We have to because we have to. We have to.
It's so hard, even with like all the traveling that sometimes happens. And
And
it's like, I want to come home and I just want to sleep for like a week, but I feel guilt because I'm
guilty.
like, I've been off on a work trip and I haven't been home. So I got to do the chores, make sure the house is in order, get the kid ready for school next week. Like, what all the things where there's no time to
Sit
recover.
down and breathe. Recover. That's a good word. Recover. You're right.
Hmm.
You're so right. And then, and I'm fortunate. I had 3 months off of work. I know a lot of people who don't. They're off
Yeah.
for a couple weeks, maybe a month, and are going back after having one of the most traumatic experiences, not only on your body, but on your mental. And we're jumping right back into life
Hmm.
and never pausing. Yeah, it's interesting.
Hmm.
It's a very interesting system we have here.
Hmm. Sure is. What now I haven't talked to anybody else in these podcasts about this, but I'm going to with you, is what is your work like, the outpatient and the community-based organizations, like what have y'all been able to do and seen success with?
Oh, that's a great question. So the work that I get to do has been around working with outpatient prenatal care clinics. And so we've had 5 pilots now. And with that, we've been able to help them implement or, update, change, improve, because some of them have had screening systems, some of them have not. But we've supported them in implementing systematic non-medical needs screening so that they're asking their patients basically really, right, how can I support you? Are there any transportation insecurities? If so, how can we support you? And the pilots look a little different, but I'll share one of our pilots where they're connected with a community-based organization. And so a patient is screened at their first prenatal appointment, and that, if they're screened positive for having some sort of non-medical need, their clinician or, nurse MA will then send a referral over to that community-based organization. From there, they're connecting the patient saying, hey, I got this referral from you. I want to ask you a couple more questions just to make sure we didn't miss anything. And for an example, I see you have transportation insecurity. Well, we have these ride vouchers, or we're able to connect with your insurance. So really providing them with those resources to then help remove those barriers to care. And then the final step usually is working with their providers to do some sort of care adjustment, whether that is virtual visits, whether that's group prenatal care, or whether that is streamlining their visits. And so we've had really good successes in, like I said, a couple of our pilots where we're able to systematically screen and get those patient resources. And it's not always a community-based organization. Sometimes it's a resource list where patients are able to review the list, call people or call those resources to be able to get really the support that they need to be successful, not even successful, but to be well supported throughout their pregnancy journey. And so that has been some of the work we've been able to do the past couple of years.
How are you connecting with the community-based organizations? People are always asking, like, well, how do I connect with them? I'm like, talk to them.
That's a great question. The work that I've been able to do has been traditionally grant funded. And so usually, there's, usually, a couple organizations that are doing really great work. And those are the organizations that you can either go to say, hey, I have this idea. Can we partner? This is what we're thinking about. Or they're like coming to you saying, I see the work that you're doing. We want to collaborate. This is how we partner. And so I think it's really just being out in the community, making those connections, sharing the work that you're doing. You start to get an idea for like what's happening. And I think that was one of the biggest hills that I had to kind of climb when I first started in this space a couple of years ago, is trying to figure out who are kind of the key players. Like what is a community, what is a CBO, right? What do they provide? What are they doing? So, my team and I have been able to look across, our state to see where those key players are at, and like where those resources are at, and how we can connect our clinics to these resources outside of grant funding, right? So like when our grants end, how we could create this sustainability. And it's really through opening those doors of communication with folks.
Excellent. I love that. How's your community advisory group helping with that as well?
They're incredible. I have truly just I've had such a great experience. I have 6 now of the most amazing human beings on our group. And so what we try to have them do is review anything that patients will see. And so our workflows, our patient flyers, our screening tools, we have them review that to be able to provide really that patient perspective. Like, yes, I am a mother. I've been in the maternity care space, but sometimes I think we get a little bit more removed. And like that personal professional line is very interesting sometimes. And so I have these 6 people who are in various different spaces, all with maternity care experience, who can review all of our things to make sure that it is culturally competent, that is trauma informed, and that it is patient friendly and patient centered. And so any of our work with our pilots, with other things, like we have our PCAP review. And there we try to work with them as really like a not even an advisory board, but like our decision makers to say, what should we be doing? And they tell us, we discuss it, and then we implement it. And so we've had an incredible experience and an incredible journey with our PCAP so far.
That's awesome. It's being able to have a group like that you can go to and be like, what are the needs? What are your needs? And instead of coming like, this is a solution that we think is going to work, but asking them like, what is it that you need? Because they're going to ones like, if you don't do that, you don't have that buy-in, like people aren't going to use it. And then there's a whole different issue. Right. But being able to utilize them for that is amazing. And having them being the decision maker. I love to hear that. Yeah, I love that. I was like, there was something I was thinking. It left my mind.
And
I
I was
lost
going to
it.
share with RPCAB. One other thing I wanted to make sure I shared. You know, when I launched RPCAB 2 years ago, I was new to this space. I was taking my experience and trying to create really a safe space for folks, right? And I just have to shout out RPCAB because they have met me with so much grace and understanding and thoughtfulness and kindness. And I just appreciate that. And I appreciate that I'm able to use my personal experiences and my professional work for the most part to really elevate patient voices. And again, all of our PCAB members come through Mama's Voices training, and that will be something that we will continue to do as we grow and expand because I do think it's such a need for folks to have this tool, right? This training. And so I just love our PCAB. They're great.
I can see that. Like your face just started glowing when you're talking about them.
They're incredible.
That's what I was thinking was about like how, even though we have our own, you and I each have our own birth experience. We're in this person off the street, right? And so it kind of influences, or it can influence our own thought process and things like that. And so having a group of people that have the different backgrounds, the different experiences, like what we teach is if you're going to have patients that are bringing in their stories and having some influence over what your work is, you need to have more than one voice.
Yeah, I agree.
Because we might have the exact same demographics and have had different outcomes and experiences. We might have had the same experience, but we took it differently.
Exactly.
And so, we have to have many different voices that are in the room that are sharing that, because if you make a policy on one person's experience,
you're in trouble.
I can tell you it's going to backfire on you. It's going to backfire on you. So you have to have that representation that's out there instead of I've seen the ones that have made policies on one voice and it didn't last. So that's great that you're able to work with your group that way.
Yeah, thank you. Thank you. I'm super fortunate and grateful for that experience too.
Well, as we're wrapping up our time together, I'll ask you one last question.
Okay.
If someone is thinking about taking Mama's Voices patient family partner training and they're maybe nervous or hesitant about it, what would you say to them? What advice would you give them?
I would say this will be one of the best investments you make in yourself. Like I said, I felt like a long time I didn't have a story to share and I didn't know how to share it. But meeting with Mama's Voices, going through the training, not only learning how to write out my story, I was able to learn how to articulate it, not only to just like my family and friends, but you guys have a piece in there about how you talk to your policymakers to make sure they're not making policies that's for certain groups of people, but that benefit the majority of birthing people. It also just tells you and shows you how important it is to take care of yourself. So I will say, if you're nervous or scared, just think about this as one of the best investments you can make for yourself.
Ooh, we're going to take that as some self-care.
Yes, exactly.
That's going to be a new point to talk about Mama's Voices training. It's self-care.
Yeah, you can do this and then go get a massage, but you get this off your mental. And I think that you talk about this, and I've taken it 2 years ago, but you guys talk about giving yourself space to even think about your birthing story, right? To be able to digest it and then go get a massage.
We've been doing some chair yoga. With some chair yoga flashcards. And so whenever we have some big meetings at work, they usually get pulled out and we do some breathing and vinyasas before we dig into the hard stuff. So
I love that. I love that.
Awesome. Well, thank you, Briaa, for your time today and meeting with us. I'm so glad I got to catch up with you today and hear about all the great things that y'all are continuing to do. I could see your passion and truly your face was glowing when you're talking about your PCAB. like
Love
glowing.
them. Thank you. Thank you, Nicole. Yes, it's always a pleasure to be able to connect with you. And I hope to talk to you soon. But thank you for your time and for allowing me to share my birthing story today.